Welcome. You're tuned into Life is a Sacred Journey. Every week, we bring a new perspective to aging and caregiving. Here is your host, Michelle Pope.
Good morning, good afternoon, or good evening, wherever you are joining us in the virtual neighborhood of Life is a Sacred Journey. My name is Michelle Pope, and I am your host for this half hour, this wonderful journey, and I'm excited. I love people. Right? I'm into people. I think people are amazing. Even when we're at our worst, and I know something must have happened to that person to get them at their worst, I still love people. And I met Robert Espinoza about 7 years ago now, when we first started Life is a Sacred Journey as a podcast. It was an hour long. It was on Friday evenings at 6 o'clock. And he came on and did a full hour. He was in New York. I'm here in California. It was wonderful. We connected, promised to have dinner in New York one day, and life happened. And then COVID happened because I was coming to New York last year for something else that got canceled. But we've kept in touch through LinkedIn and following each other's work and what we're doing. And so I'm tickled. I wish you could see me. I'm almost coming out of my chair because I'm so excited to physically meet him, as well as to have him share his work with you and the knowledge that he has learned in his career. So much is going on in the world of aging. We're raising up the consciousness of our communities around LGBTQI aging. We're listening to more and more about minority lives, meaning Black lives, brown lives, indigenous lives, and how they're aging. We're learning more about age-friendly communities and what that really looks like, all of that. We're talking about ageism for the first time in a way. We're like, stop talking about old people and young people in a way that is demeaning and discrediting. We are at an impasse in our humanity. And I'm not happy about COVID. COVID was terrible, but COVID made us start to think, because we were forced to look at images that we were never looking at before, and we were forced to have discussions that we never had before. I hope as you move out of this COVID time that you will continue to run the race and don't go back to the dark ages where we were ignorant about some things, because now we know. When you know, you got to do better. And so stay in the movement of what I'm calling the humanity movement. It's the humanity movement. Let's get back to this space, or no, not back, move forward to a time where humanity is just that. Because the reason that we have to use all these titles and things that I can hardly remember is because we have demeaned the human being. And when you demean a human being, then they have to do everything they can to be recognized and heard. And if we get rid of that, then I can just be Michelle. Not Michelle, the Black person, just Michelle. Robert can be just Robert, not Robert Deputy Dippity Dip, because we have to hold our titles in order for humanity to respect us. So I'm thankful that Robert Espinoza is with us this morning, because he stands for that. And that's why I follow him. And he is a near, dear person to my heart. So let me tell you a little bit about him, and we'll get started in a conversation. Robert Espinoza is the Vice President of Policy at PHI, where he oversees its national advocacy, research, and public education division on the direct care workforce. We're talking CNAs, home health aides, folks out there, essential workers, including its strategic direction. In 2020, he was selected for the first ever Care 100 list of the most innovative people working to reimagine how we care in America today, as one of Next Avenue's 2020 influencers in aging. Robert is a nationally recognized expert, frequent speaker on aging, long-term care, workforce, and equity issues. For more than 20 years, he has spearheaded a high-profile advocacy campaigns and written landmark reports on aging and long-term care, LGBT rights, racial justice, immigration, among a variety of other topics. He has appeared in multiple media outlets, including the New York Times, Wall Street Journal, NPR, CNN, Forbes, and the Washington Post. And his writing has been published in the Huffington Post, The Hill, and Politico, among others. Robert serves on the board of directors for the American Society of Aging and the National Academy of Social Insurance. And in 2015, he was appointed by the Centers for Medicare and Medicaid Services to its advisory board on outreach and education, as well as by the National Academies of Sciences, Engineering, and Medicine to its forum on aging, disability, and independence. I could go on, but I'm going to say one more thing because this is near and dear to my heart. Prior to PHI, when I met Robert, he was at SAGE. And SAGE is a premier organization that really works with LGBTQIA older adults. And at SAGE, he established its national advocacy program. And as you know, our LGBTQIA elders are the invisible sector of our aging conversation. We do not have enough conversation around that. We do not have enough environments and models of care to support our brothers and sisters from the LGBTQI community. And so SAGE plays a pivotal role in that. And Robert was one of its leaders in communication and education. So I just have to share that because that's important part of his history and an important part of the humanity that he represents. So thank you so much, Robert. Again, it means so much to me that you have joined me here this morning on Life is a Sacred Journey.
Thank you, Michelle, and thank you for that introduction. Also, thank you to everyone who's joining us, and thank you to Life is a Sacred Journey for just all the conversations that you're able to highlight. I also feel like in many ways, like you and I have been on our own sacred journey over the last 6-7 years since we first met. I mean, certainly you with this podcast and this conversation series as it's evolved, and it's so good to virtually meet you.
I know, right? I was thinking that the other day. I said to someone, you know, it's interesting when you're doing this work and you talk to people all the time, but then you don't meet them. And
Sure.
And it's almost like being a kid in the candy store when you finally meet someone that you've called friend in your heart or in your imagination. And then you see them and you're like, yeah, they really are my kindred. So
thank you.
Bring us up to speed. You know, before we went live, I was talking about the California Master Plan on Aging. This is an incredible document that will, for a decade, be the marching orders, morphing over the decades. So that's why we're having ongoing conversations within every county and with every sector. But, you know, we finally have gotten to a place that we understand that having a master plan around everything that has to do with aging is important. So would you explain to our Life is a Sacred Journey listeners, followers, audience, you know, why this is important and why they should participate in their community and find out whether or not their state community has a master plan?
Mm-hmm. Yeah, absolutely. I mean, I think the plan is groundbreaking in the sense that, you know, it's a way in which a state can really think about the broad range of issues, realities, and strengths that older adults have in a state, and the variety of ways in which they're interconnected, the variety of ways that a state government can invest and boost. And it's also long-term and visionary, so it does lay out 10 years of work, or a 10-year roadmap, and then the first year of kind of metrics and goals and what the state should be focusing on. A few months ago, I wrote a report on how the master plan on aging addresses direct care workers and the opportunities there are to really support home care workers and nursing assistants throughout the state to better deliver services and supports to older adults and people with disabilities, of course. And I think, a few points that I would make in terms of its historical nature. One is that I think it's a great acknowledgement that, we are becoming an increasingly older country. Many people in our field, you and I included, have been really sounding, I want to say the alarm, but at least kind of raising the flag on the idea that, we are a country where the number of people who are turning 65 is growing every day. 10,000 people turn 65 every day. But also people are living longer. We're seeing now people live in their 80s and 90s. And that's a wonderful medical success. And it's a great example of the ways older adults are contributing to this country in ways never seen before. But it also raises questions about, have we designed our country's system in such a way that we're adequately prepared and resourced to support older adults? And I think, one of the smartest things about this plan is that it takes a step back and says it's not about the individual silos as much. It's not about, a pocket of funding for elder abuse and a pocket of funding for workforce development and so on. It's about looking at the issue holistically. And it's about saying, let's take a step back. And it's about evaluating and setting concrete metrics that we can look forward every year and say, are we making progress or are we not? So I'm really hopeful that it kind of sets the standard for what other states do.
In the master plan, in every state it will be different, but the primary focus is around what I think is important: how we are compensating and educating our direct care workers in the elder care field.
Mm-hmm.
And so, traditionally, we know that CNAs and home health aides and folks that work in congregate living spaces, or what I say, do the heavy lifting of the care, are the ones that make the less salary. They're expected to live on minimum wage. They many times do not have benefits and do not accumulate the type of personal wealth, I'm going to call it wealth, just to live. Usually we equate wealth with people being able to buy luxuries, but I'm going to change that. I'm talking about the true meaning of wealth means having money to cover your life expenses and to send your kids to college and buy a car so that you don't have to take public. Wealth means being able to live. So we in this country have gotten it wrong. And finally, we're saying, whoa, 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 especially the pandemic opened our eyes to this also. How did we get to that place where essential workers were not looked at as primary care providers? And then what do you see happening to shift us to this new reality that we understand they are essential workers, just like a doctor, a physical therapist?
Yeah. Absolutely. It's a great question. And it's a big question because I think there are a number of factors involved. I mean, I think, I would start first with, the primary people that direct care workers support are older adults and people with disabilities. And we do live in a country of incredible ageism and ableism. We disregard older adults and people with disabilities in a variety of ways. And we see that, through public policy. We see that through kind of the funding of services and supports. I apologize, I'm by an airport, so you might be hearing some airport sounds. And I think in our everyday lives, and I think COVID-19, really reinforced that in that, some of the people most at risk were older adults and people with disabilities in nursing homes, right? And that's just a great example, an unfortunate example of how we disregard older adults. So I think, in doing so, we're also disregarding the entire system and the people, the workers who support that. The other piece is that, this is a workforce that is primarily made up of women, of people of color, and of immigrants. And these are populations that have long been marginalized in every facet of American society. And when you look at the historical record on home care workers in particular, and you go back to the 1930s where, as a country, we were debating the New Deal and which workforces should be covered by wage and overtime protections, what the historical records show is that many members of Congress, especially from the South, use these racist and sexist arguments to exempt home care workers from those protections. They argued that, that it was women's work and women's work wasn't as valuable. And so if it's not as, women are innately able to do this work, so it's not really work. And a lot of the workers were Black people, Black women from the South. And it was the way in which we continued kind of slavery and Jim Crow, right? We created a workforce that was further exploited. And so I do think we're at a point where we should be thinking about how to correct those wrongs and how to really strengthen this workforce, right? And we can do that by, improving compensation, providing full-time hours, really strengthening the training system, the requirements, the funding, creating career advancement opportunities, and just generally transforming this job so that a worker sees this as a career and is rewarded for the same level of essential rewards that they're offering their clients, Yeah.
Well, I love that you said that, because that's even the way that we think about this position as a job. It also, I've heard, and some of you may know what I'm getting ready to say, but I've heard caregivers speak ill of the people in the facilities or neighborhoods, whatever we're choosing to call them, ill of them by their ethnicity, by the fact that they're not educated or that they don't understand certain things. And so what Robert is saying is that that's on the facilities to educate and train about dementia, or educate and train about how to speak to the caregiver when they come in. You cannot expect someone to have that just because they happen to be there doing the heavy lifting. Okay, because when they're doing the heavy lifting, guess what? They're right there with your loved one. They're not looking around trying to figure out what's going on in the stratosphere. That's administrative. And so if you have a problem, it's not about reporting that individual. It's about saying to that institution, that corporate structure, you need to educate your individuals, not beat up the person that's doing the work. That is ridiculous, because they're doing the work. The administrative person is the one responsible for the budget on how their folks get trained. I'm just saying, you're barking up the wrong tree when you do that. I had to tell a family member that, don't yell at that person. It's not their fault. This was during COVID. They didn't have enough masks. They were wearing a mask that they had been wearing for a week. And the lady was mad. And I'm like, they can't go out and buy masks. They only make $13 an hour. I'm sorry.
Absolutely. That is a problem in our sector as well, and in the direct care sector, where there is a tendency for society to blame these workers as if they're not part of a broader system that has systemic problems or systemic reasons, right? We saw this during COVID early on, where because the pandemic exploded first in nursing homes, people looked at who's responsible for that. And they said it was nursing assistants who were coming, they were going from job to multiple job, and they're the ones who were the vectors for transmission, et cetera. And that might be true from a kind of an epidemiological perspective, but from a systemic perspective, what should be noted is that, many workers had multiple jobs because their primary job didn't pay enough, right? And also it was really up to the nursing home and the state and the federal government to ensure that these workers were being properly tested, masked, properly supported, et cetera. I will say on the consumer side, you mentioned in my introduction that I worked at Sage for 5 years. And I think that's a big part of my thinking in this work as well, is looking at the consumer side, where we heard numerous stories of LGBT older adults who were often kind of at the mercy of workers and employees who were homophobic, who were transphobic, and in some cases faced, bias, hostility, discrimination, violence even. And that's really, really unfortunate. And for me, the solution there is twofold. It is about training and about education. We need to make sure that more and more people understand kind of LGBT cultural competence, and Sage has a phenomenal program called Sage Care in this regard, and there are others as well. But also we need to strengthen the legal protections of both residents and workers, right? So that whenever, an act of violence or discrimination happens that goes beyond just kind of misinformation, that people have the law on their side.
Yes, and that our ombudsman groups are being trained in that way so that they too can be advocates for LGBTQIA. I really,
That's right.
this is my big thing now in my heart, because I hear you and I know some of my friends who have now become elders who are LGBTQ, they're finding it very difficult to be treated with respect when they go in and they want to change some of the ways that the facilities are set up. They are very much heterosexual in their activities and everything. And they're saying, but wait a minute, I live here too.
Yeah.
And
That's
so again, it goes back, Robert, to that whole conversation about humanity. If I need to have a comfortable bed to sleep in, so do you. If I need to have music and dance in my life, possibly so do you. And so there's a difference between equality and equity.
That's right. Yeah, you know, my own mom, who passed away in December, she was in a nursing home for I would say about 8 years. And she, you know, she barely spoke English. She's from Mexico. And when she entered the nursing home, you know, really overnight because of a health crisis, you know, I think she really, and we really quickly discovered how far nursing homes are from being welcoming for people who are not white, not American, not, you know, not monolingual English speaking, not straight, et cetera, right? And she advocated for years for a Spanish language channel. And eventually they brought one in, and, you know, there were always problems where, you know, the channel would be working for like a few months and then it would not go. And I don't think we realize, like, you know, how central that Spanish language channel was to her health, to her, you know, to addressing issues of loneliness and isolation, to keeping her thriving. And so I think the more, you know, we as a long-term care system really center and think about the experiences of people, you know, who bring that, you know, who still face that inequality when they enter the system, I think we'll just have a stronger system for everyone. Yeah.
Yes, a good friend of Life is a Sacred Journey, and personally, the Michelle Pope is he's a documentary is Chris Bravo, and his mother. He was looking for a place for his mother and had a difficult time, and he did a documentary short on this. Just, you know, everybody was selling to him, and he recognized very quickly nobody was actually trying to sell to the needs of the mom. And again, she has dementia. And so it was sort of like, wait a minute, but she's the one that's going to be living here. And this documentary is so beautiful because the way we market long-term care is also a challenge, because we do it in a way where we are definitely marketing to the caregiver, which is, I get it, but the caregiver isn't going to be living there. How do people with dementia feel being locked away at the back of the building? I don't know. Maybe they don't like that. Maybe that's the reason they're always trying to wander to the front of the building.
That's right.
Who knows? I don't know. But at the end of the day, the things that we're doing are to please the wrong person.
Yeah.
You know, it's like, oh, I feel better now spending $8,000 a month because you have a chandelier in your foyer.
Exactly. Yeah. You know, one of the tensions or possibilities, depending on how you look at it, in the long-term care system is sort of the balance between what many would argue is kind of training related to competence, right? Like dementia competence, LGBT competence, cultural linguistic competence, et cetera. And this other side, which, you know, looks at kind of person-centered care, the idea that we should really be looking at the needs of the individual. And the reality is it's both, right? Like sometimes they can sometimes get in the way of each other. For example, if you just we would see people, for example, they undergo an LGBT cultural competence training and they form these assumptions about, well, if you're lesbian or gay or bisexual, transgender, QIA as well, right? You must have gone through this historical experience, right? Well, not necessarily, right? Like you still need to understand as individuals, like, and people have individual aspirations too, and we forget that it's the combination of both. Yeah.
Exactly. And how important it is. Even I've been having this conversation with our millennial and XYZ folks that identify as LGBTQIA and
Mm.
all this new terminology. Okay, there's a whole new battery of terminology that I, being a child of the 50s, 60s, I know nothing about.
Yeah.
It was LGBT, it was lesbian, gay, bisexual. That's
For
it.
sure.
And so now learning, but also saying to, because again, ageism goes both ways, saying to the young people, hold up, because there's a whole bunch of folks from Stonewall generation that still don't speak the same language that you speak. And
Yeah.
so let's bring the vocabulary together so that we understand, and therefore train people like my staff around what that all means, because you may have a person that is a millennial, but a baby boomer is looking at stuff from a
Right.
very different space. But so how does that play out in this whole level of care, whether it's LGBTQI or just humanity?
Yeah, I mean, terminology, language, it's such a powerful tool, and it can be used in ways that, really deny people their humanity, and it can be used in ways that really liberate us from our challenges. And I'm always, I love this quote by Nicole Krauss, a writer, who says, "When will we learn that there isn't a word for everything?" Right? And so we are limited by language, right? But there are certainly and I saw what you just described as SAGE,
Yeah.
where the word queer was not widely embraced by a number of older adults in our senior center. Senior was an embraced term, right? Where people would say, like, that was a really hostile, derogatory word, and it's triggering, and I'm not going to embrace it, right? But we see this with other terms. We see it with the word facility. To what extent does that, create, kind of reinforce this idea of, especially nursing homes, as kind of like quote unquote prisons, or kind of these industrial settings that
Yes.
cage people or warehouse people. I've heard that term. And there are plenty of examples on the disability rights side where the tension between care versus services and supports, right? Caring might have, for some, a paternalism to it, whereas services and supports feels more agency. And yet people will say care also can mean I care about people, not just I'm caring for you, right? So it's never perfect. And I go back to I think we should stay aware of the nuances. And I stay with Nicole Krauss, which is there isn't a word for everything, and that's the limitations of language.
That's a good learning for all of us. Thank you I love that quote, because there isn't. And sometimes we just have to get back to the basics and just be intentional and be with each other. That's kind of my philosophy, because it's sort of like, I just want to know you.
Exactly.
And be intentional. And I think that's something that we can bring. And you raise up for me, I said this last week, the XYZ, or millennials, even in their music, they use sometimes the N-word in rap and hip hop. Well, in my generation, and even for me today, that word cannot be used in my presence, to me, around me. I don't even care. And I don't care that some folks feel that it's diffused, because it's not diffused for me. And so the reality is, you're very right, is that something that may seem liberating for somebody, and they have moved to a whole nother consciousness around it. For somebody else, it is like taking your fist and hitting them. And so we have to always be aware of this sort of time shift that we live in, if we're all going to live together and create a movement of change.
That's right. That's right. And it brings me back to my journalism training. I was trained as a journalist in college. And there was always this idea that if the word that you're using is up for too much ambiguity, or there are different takes on it, then just explain what it is that you're trying to get to, right? So if care is paternalistic, but services and supports are inhuman, why not pick one, but then explain the limitation, right? I do feel like sometimes we rely on single words or single phrases to convey much more complex dynamics that would be better served by just describing those dynamics.
I agree with you wholeheartedly. That's why texting is so hard for me.
Exactly.
My kids hate it when I text. My son said to me one day, "Mom, a text is like a couple of words. It's not a paragraph." I remember him telling me that. I said, "But I can't say it in a couple of words because I don't want you to get the wrong impression about what I'm saying. Because I've sent some texts and you've been all mad at me and it wasn't even what I meant." So, it's like, so again, the complexity of language, the complexity of the time that we live in. And when you think about long-term care in the future, because we're going to be coming to the end of our time soon, what are some of the spaces and places that you see innovation and this, what I'm looking forward to, this sort of holistic cornucopia of services. Where do you see that in the future?
Sure. So I'll point to a few. I mean, one is that there's a conversation in California and in other states, a growing conversation about the importance of social insurance programs in long-term care that would make long-term care more affordable to consumers, and ideally would be designed in such a way that they would also strengthen direct care jobs, who are the paid front line of support and supports for family caregivers, right? So I think there's a lot of hope in that. Any of us who have gone through this system know how incredibly expensive and unaffordable long-term care is, and it's hard to prepare for it because you just don't know what that cost will be, right? So I think there is promise in that. The second is I do feel like while the conversation on technology and especially robots is overstated and a bit idyllic, there is hopefully promise in technology making long-term care and workforce issues easier, but not replacing workers by any means, right? Direct care in particular will always be best served when a person is helping another person, that human interaction, et cetera. But there might be ways in which technology can really kind of improve that and also improve services in our homes. And so I do feel like while we should kind of, hold back on whether it's going to be kind of the panacea, I do think it's something that we'll focus. And I'm hopeful. I'll end with the idea that this increased attention on systemic racism and this heightened attention on just equity issues more broadly, that it will move the needle somewhat on kind of addressing the long-term care issues as well. I say that at the same time as we're trying to dismantle critical race theory, which is not a promising development. But I do hope that sometimes you have to go through the storm to arrive at the other end, right? And I hope that we become a world that's much more thoughtful about equity.
And I am so thankful that you took time out of your day to come and speak with us, because what you just said is, to me, that is it, is that where the interconnectivity of all of the isms that we live out, racism, ageism, disability rights, all of it, homophobia, all of those isms, when they come together, and because they intersect, and where they intersect is where we need to find change. And what you just said to me also makes me feel like we need to have a conversation about them together, all of the isms together, and figure out where they do interconnect to disable long-term care, or disable or put barrier into the workforce stuff, all of it, because it's in there.
Yep.
And no matter how you look at it, I've tried to dissect it and look at it one issue at a time, and I have found that impossible.
Yep, that's right. Yeah.
So, wow, oh my gosh. Well, Robert has been with us, Robert Espinoza, dear colleague and friend. But I really would love you to follow PHI and their work. Can you share with the audience how they can do that?
Yeah, absolutely. Two ways. On social media, on Twitter and Facebook, it's at PHI National. So simply follow us on social media. Also on our website, which is phinational.org, O-R-G, you can sign up for regular email updates. So those are the two best ways. Yep.
And again, if you are a caregiver, you are a person that is giving your life and serving, caring for others, it's good for you to be aware of the discussions that are being had about the structure in which you work. And again, you are your best advocate. I know it's hard in a work environment because you don't want to be fired. Some places have union. I mean, I know, but you can be an advocate regardless, because you can always go home and write an email or a text or make a phone call to your local policymakers that have nothing to do with the work environment. So we don't want you to lose your job, but our policymakers need to hear what you're going through on a day-to-day basis to serve the humanity and so that they can make better decisions as far as where funding goes and programming and all of that. So Robert Espinoza has been an advocate, a national advocate, a writer, and somebody who really understands what's going on because he's a great listener. And he's also a person who has engaged with the community. And so he knows firsthand how all of these things affect the lives of our elders and all of us, because we're all going to be elders. Yes, we're going to live long lives. So we're all going to be elders. So we need to fix this. Robert, thank you so much. I hope we can have you back at Life is a Sacred Journey as we continue to come out of this pandemic, because we didn't talk a lot about that today, but I would like to talk about that a little bit more, about how you see systems changing because of the pandemic.
Likewise, yeah.
Yeah. So have a great, wonderful day to all of you out there in the Life is a Sacred Journey audience, and be good to yourself and know the world will not change just because we complain about it. We have to go into action, do something, talk to another person, join hands and make the humanity a better place. It's so good to always be with you. And I'm going to sign off now. Robert, stay with me 1 minute. Sign off. Have a good weekend, everybody. Be safe.
Thank you.